Right. So I'm Teri Kleinberg. I have the opportunity to present a slightly different experience. So the first thing I wanted to talk about was why I was interested in doing this program at all, and it actually started from that magazine that you see there on the right. My mom used to get that magazine. It was a travel magazine for physicians, but she never actually read it. I was the only one who would read it. And I think I was 11 years old when I first saw there's an issue that came out every year that's called that. That's a later one, but it's Doctors Who Volunteer. And I remember sitting and reading about the mercy ships and plastic surgery and doing reconstructive surgery. I thought, that's what I want to do when I grow up. And it's just so cool that it comes full circle. So what I did was went to the Dominican Republic with Dr. Bedrosian through the Voluntary Health Program. It's a program that was started by Robert and Darlene De La Roca from New York Eye and Ear Infirmary, and that's a picture of Darlene on the left and Robert, and Darlene is a nurse and also does prosthetic fittings, and Robert De La Roca is the chief of plastics at New York Eye and Ear. And so in 1995, they founded the actual location at the Institute for Latin American Concern. It's actually missionary, started by Jesuit priests, but in 1995 they helped construct the medical facility there. And every year they bring a group to do strabismus surgery, oculoplastics, cataracts, glaucoma, and glasses and screenings. And so they bring a group every year for a week that includes a full staff. So they bring their entire OR staff with them. And for future reference, there's a link to that program if anyone's interested in the future. So the Dominican Republic is a mountainous country. Santiago, the capital, is here, and that's the location for the mission. That's the sign you see when you're coming in, and that's actually the courtyard of the original mission. I was told that the original Jesuit priest used to live there, and he used to run laps around the facility to stay in shape. But this is where we stayed. There are casitas that donors gave money to build for the volunteers. So since it's been going since 1995, they're relatively new. And this is over a 4-acre facility, so it's a beautiful facility. And the hospital is actually off behind this mission area. And so the structure, I kind of wanted to go over the structure because it's similar every year. All year, the cooperadores, or their local health volunteers in the community, this is a picture of the group of them from this year, but throughout the year, they're trained to do vision screenings, and they pick out patients that they think might be helped by this week. And they bring the patients, so the volunteers come on a Saturday, arrive and set up, and the patients start arriving really, really early in the morning on Sunday, and they travel, many of them travel for hours. Some of them come from the local community as well for screening. So the screenings really start early Sunday morning, and patient selection starts there. So through the week, most of the patients are selected early in the week, and then they have their surgeries and post-ops later in the week. By the end of the week, most of the volunteers have gone by Friday, and the whole thing repeats every year. Also throughout this, we do vision screening, glasses. There's a medical doctor for the preoperative evaluations, and people have donated lasers, so we can do glaucoma laser procedures and capsulotomies there, and also prosthetic fittings. So this is what it looks like when you look out the window on Sunday morning. This is just the crowd starting to gather. But you can see out the window there's tons of people lined up, and they wrap around the side of the building. The group of us that came were over 60 volunteers, including 13 ophthalmologists and a full anesthesia team and surgical techs and nurses. And we treated over 1,600 patients that week, so it's a nice opportunity to offer a lot of help. And what I did, I kept a little journal so I wouldn't forget, but I got to do actually a lot of glaucoma lasers, which was a great opportunity because it was something that they always needed somebody to do, and it was something that I could do that I didn't need to be supervised doing. So that was a fun thing that I could help contribute on my own. But I also got to do plastics procedures with Dr. Bedrosian. So I did frontalis slings and socket reconstructions and a bunch of pterygia, which we don't see quite as often here in Philadelphia. And so I wanted to show a couple of the things we saw. So we did see a lot of pathology. We did a lot of routine, eye exams, saw a lot of cataracts, but we saw, this was a really unusual case that we saw coming in that Dr. Bedrosian operated on. And he came with this mass that had been there since he was a kid, that had grown through his life, and was removed and sent to pathology. I don't know what the final pathology was. They have a pathologist and they have an ophthalmologist in town that can do follow-ups as well. And this is a little girl who came in that we were able to evaluate as well. And I think she had blepharophimosis with ptosis syndactyly and short stature, but we only got to see her for a brief period of time. So I don't know if maybe Dr. Levin would know. But I wanted to show a picture of the operating room. So it started off this part of the room being general anesthesia with the anesthesiologist here, and then this side for pterygia under a small operating microscope here. And there were just so many patients that needed help that we brought in a third bed for local procedures that were just done under local anesthesia. So there was 3 beds going. And that was just the plastics room. So we also had another room for cataracts and another room for strabismus. So we had 3 ORs going all the time. And this is a picture of me doing a pterygium. And here's one of our other cases. It was a socket reconstruction in a little girl who had lost her eye in an accident and couldn't retain a prosthetic. So she was this beautiful little kid who couldn't, who didn't look normal. So we were able to reconstruct her socket, and they actually, Darlene Della Rocca, ground down the prosthetic to fit for her. So instead of using a conformer, they would use the prosthetic. And so this is what she looked like before, and they always take before and after pictures for the charts because they keep these records for the patients if they come back another year. And that's what she looked like afterwards, and she was very happy. So I wanted to show a contrast of where I stayed. So I had a really nice place to stay in the casita that was much nicer than I had anticipated, quite basic but nice. And this is where my patients stayed, so we would go afterwards to do our post-operative checks in the evening. And you can see I had to sort of step over this poor woman. I'm right here to see some patients back in the corner there. And this is another view. So we had so many patients. We had about 4 or 5 exam rooms. And I had to sort of jerry-rig a little exam station for my post-operative visits for some of the surgeries that I did. And this woman was so nice and brought me a scrunchie, which I thought was very sweet. Chris Brown was also there. He'd graduated class of 2000, so he was doing cataract surgeries. He's gone back year after year with his group. And I saw one of his surgeries, and I said, "Can I touch that cataract? I've never seen a cataract that looked like that." It was just sitting on the table, so I got to pick it up and never quite seen anything like it. And this is a picture of the room with Ben Roberts and one of his colleagues who came with him in the room. So what I learned, this is actually a picture that I took from the Guyton lecture that I was just at before I left. So I went the week before OCAPS. And he had a quote from Dr. Bedell's obituary, who trained at Wills. And it said, "The greatest thing a human soul ever does in the world is to see something and tell what it saw in a plain way. To see clearly is poetry, prophecy, and religion all in one." And I thought that this was medicine seen clearly. This is really why I went into medicine. And so in the future, I'd like to take a week or every year or two to do a program like this. And perhaps later I could do something with an organization like Orbis in the future to share subspecialty skills once I have some. And I'd like to involve my family early on. I think it's never too early to volunteer. And it was really inspirational to see the doctors who brought their families with them to help out. So for me, that's the future. And thank you, everybody, particularly the Wills Eye Society, for helping me pay for this and enjoy this experience. And thank you, Dr. Bedrosian, for taking me with you.